Hi everyone, my name is Emily. I'm one of the pharmacists here at MD Custom RX. If you haven't already, make sure that you go watch my video from last week on UTIs. You can find it on our YouTube channel or you can find it in the show notes below. Today we're going to be talking about yeast infections and different risk factors that can cause overgrowth of yeast, as well as how we can repair the vaginal microbiome. Let's get into today's content. And then the next microbiome challenge that we'll talk about is yeast infections. Again, very common. A yeast infection is a fungal infection basically, and symptoms can range in severity, and this can include intense itching and irritation, burning sensation, redness and swelling of the vulva, as well as vaginal pain and soreness, and like a thick white odor-free vaginal discharge, kind of like a cottage cheese appearance, and watery vaginal discharge. I know that's exactly what you want to be picturing right now, but that's just kind of the description. So the vagina naturally contains that mix of yeast, including the candida and bacteria. And then certain bacteria, like the lactobacillus, act to prevent that overgrowth of the yeast. But the balance can also be disrupted, and so many things can cause disruption of that balance. And then an overgrowth of the yeast or penetration of the fungus into deeper vaginal cells, like different cell layers, can cause the signs and symptoms of a yeast infection. So some risk factors, like I mentioned before, antibiotic use, that's a big one. Yeast infections are common in women who take antibiotics. Broad spectrum antibiotics are meant to just kill a wide range of bacteria, and unfortunately they can also kill the good bacteria in your vagina, and then that leads to the overgrowth of yeast. And then, so actually increased estrogen levels, yeast infections are more common in women with high, like really high estrogen levels, such as pregnant women or women taking high dose estrogen birth control pills, or even just like estrogen hormone therapy that's really high. So that's why it's important, if you are using hormones, to get your levels tested and make sure that you're within that optimal range. Also, uncontrolled diabetes is a big one. Women with poorly controlled blood sugar, they're at greater risk of yeast infection than someone who has good blood sugar control, just because yeast loves sugar, so it'll grow easier. And then women with an impaired immune system, usually with lowered immunity, such as like corticosteroid therapy or like autoimmune diseases, they're more likely to get yeast infections. So prevention of yeast infections involves kind of the same as BV, like avoiding the wet or tight clothing, clothes that can hold moisture, avoid douching, and then any unnecessary antibiotic use. And then supplementation can always help. So with the probiotics that are formulated for vaginal health, like I said, it's always a good idea when you have any microbiome issues like that to just supplement with that. And then berberine has also been shown to have antimicrobial and antifungal properties. So there's various studies that show that it's highly effective against the Candida albicans, which is what causes the main, that's the main yeast that causes yeast infections. And then we have a product called cystostatin that has the berberine with the unique botanical blend to kind of maintain that healthy urinary tract. It's called cystostatin. Yeah. And then turmeric has also been shown to be to have those antifungal properties as well. There's a number of studies that have pointed to turmeric's efficacy with both Candida albicans and the biofilms that it forms. So I thought that was really interesting, because usually you see that for like pain and things like that. And then we can of course compound for yeast infections. Like I mentioned before, boric acid is a good option because it does have those antifungal and antiseptic properties. And that can be made into a cream or a suppository. And then another option, which is usually not one of the first things that providers will try, usually like down the line, is called amphotericin B. This is a very strong antifungal agent, and it binds to the fungal cell membrane and leads to cell death of the fungus. And that can also be made into a cream or a suppository.
Thank you for watching. If you found value in today's video, I would encourage you to head over to our YouTube channel and go under the live section where you can watch the full-length vaginal health seminar. As a reminder, we do offer one-on-one consultations where you can sit down with a pharmacist. We'll go over your medication and your supplement lists, and we'll make recommendations to optimize your health. If that's something that interests you, please call the pharmacy today and we'd be happy to schedule an appointment for you. In next week's video, we're going to be talking about bacterial vaginosis from a functional medicine standpoint. Thanks for watching. I hope you have a great day and see you next time.